Aisha, over to you.
All right. Hello, everyone, and welcome to this timely and important webinar on invisible emergencies, climate change, mental health, and health diplomacy, organized by the Health Diplomacy Youth Network with support from the Health Diplomacy Alliance. My name is Aisha Ali, and I am the coordinator of the Commonwealth Youth Health Network and member of the Health Diplomacy Youth Network. And we are delighted to have you join us for this intergenerational dialogue as we explore how climate change is shaping mental health outcomes and how health diplomacy can advance inclusive and resilient solutions. Before we begin, I'd like to share a few housekeeping notes. One, please keep your microphones muted throughout the session to avoid background interruptions. Two, we encourage you to use the chat and Q&A functions to share reflections, engage in discussion, and pose questions for our speakers. Three, live captions are available in this webinar and can be activated in your preferred language through the meeting settings. And four, we will also be sharing the bios of our speakers in the chat for your reference, along with relevant resources and publications. Thank you once again for joining us. We look forward to an insightful and engaging conversation. Now that we've covered the housekeeping notes, please allow me to briefly introduce the Health Diplomacy Youth Network. The network is a youth-led platform supported by the Health Diplomacy Alliance, bringing together young professionals, advocates, and emerging leaders from across regions. Our mission is to elevate youth contributions in global health, strengthen research and policy engagement, and foster collaborative spaces that address emerging and challenges with a focus on equity, inclusivity, and sustainability. In light of the growing urgency at the intersection of climate change and mental health, we have convened a diverse panel of speakers with global and regional expertise to share insights on how health diplomacy can advance meaningful, resilient, and people-centered responses. It is now my pleasure to introduce our moderator, Ubunloa Ayanmode, rapporteur of the Health Diplomacy Youth Network, who will guide today's discussion with our distinguished speakers joining us around the world.
Thank you, Aisha, and good afternoon, good morning, good evening from around the world. I am Ubunloa Ayanmode, and I'll be the moderator for this great session. I'm the rapporteur for the Health Diplomacy Youth Alliance, and thank you for joining. So to begin our discussion and help ground today's theme, I would like to invite our first speaker, Matteo Consiglio, my apologies. So I would take his bio and it would have the floor. Mr. Matteo is a policy and partnership professional working at the intersection of food systems, environment, and health. He is the founder of the Health Diplomacy Youth Network and serves as the food and water systems lead at Swiss Youth for Climate. His experience spans civil society, government, international organizations, including field research in Brazil and engagements with FAO. Matteo works on advancing One Health, sustainable food systems, and inclusive global health governance. Matteo, we welcome you, and the floor is yours.
Thank you very, very much, and well, thank you for having me. And yeah, I think this discussion is extremely important and extremely timely, in particular, given that we are toward the end of COP, and in the sense to look right at what is the intersection between, for example, climate change, food systems, and mental health, which is often one of the aspects that when we look at One Health is not really there, sadly. What I would like to share with you is one specific example of when I did my research in Brazil, because I think it really shows how the intersection of mental health with other topics, it's sometimes harder to grasp the more up you go, but at the local level, it's extremely clear because the people who experience distress and mental health effects leave everything as one. And so when I was in southern Brazil, I did this research with the Guarani Ambaya, which are an indigenous group, primarily within the state of Santa Catarina and Paraná. And basically, they have already an extremely reduced amount of land due to the, let's say, indigenous situation throughout the centuries in Brazil. And in this reduced land, they also suffered disproportionately from the effects of climate change, and I would say overall like anthropogenic processes. So we go from droughts to land acidification, which in practice means that they are not only unable to produce enough indigenous food, which means with specific indigenous seeds, but they're also extremely reliant on food aid from the federal government, and this means that they are not able to do their cultural practices specifically related to food, and this, I would say, uprootedness of their culture created an extreme level of mental health issues, because for them it is still sadly not able to fully be a community binded by their culture. And however, youth, which as we'll know is often the one that has the transformative role. So the youth indigenous leaders were actually able to fight specifically with the hospitals and the federal government to have their specific food needs, cultural food needs met. And what is interesting in how they did this is that instead of going from an angle of the right to food, where the fight with the government was more complicated, because they said for example that mothers giving birth cannot eat meat, and in Brazil there is a strong idea that eating meat for mothers is one of the healthiest possible diets that can be provided, and how in the end they were able to actually obtain this cardápio, which means this sort of menu in hospitals, which in practice it means food guidelines in hospital, was through the respect of the right to mental health, because the burden on mothers who were forced to feed themselves with meat, and feeling that they were actively hurting their children was so big and documented that they were then able to proceed with this path, and this specific indigenous group, let's say indigenous, let's call it tribe, close to Joinville, which is this town, he is now leading the way to allow as many aldeias, which is the sort of, let's say, tribal lands, to adopt this system both within hospitals and within schools, because also there the food in the indigenous schools is provided by the federal government, and then at the same time we have this horizontal approach, which is horizontal not out of willingness of being inclusive, but just out of need. It's also going within a broader legal battle, and yeah, so mental health becomes a tool of empowerment in this sense. Thank you very much.
Thank you so much. Thank you so much. In the interest of time, I sincerely apologize if our speakers may have just little short time, but the goal is just to have a robust discussion and pass information along. Thank you, Matthew, for your insightful remarks, your reflection on how climate-driven disruptions to food systems translate to psychological distress. You know, It provides a great entry point for today's discussion. Our next speaker is Dr. Jacob Esbiel, who is the co-chair of the Universal Health Coverage Working Group at the Global Mental Health Action Network. His work integrates human rights, governance, and system reliance to strengthen international standards for dignified, safe, and accountable mental health care. Today, Dr. Bill will speak on community mental health approaches and climate-affected areas. Thank you, Dr. Bill, for joining us, and the floor is yours. Sorry, Dr. Bill, you're muted.
Hello again. Thank you for having me, and thank you for the opportunity to address you with an issue that is not necessarily visible, I would say, in global healthcare area, and the dimension of the climate crisis that is often associated with trauma. And we have to admit that there are large communities and smaller communities affected by trauma, and which originates from climate affected areas, from climate crisis. So we have to be aware that climate events trigger complex and cumulative trauma. That's not only singular trauma that we may think of. When climate disasters strike, like floods, typhoons, droughts, wildfires, and heat waves, they do not only create a single moment of a psychological shock, but they also create a chain of traumatic experiences. So we have to understand that trauma experiences in climate affected areas are mostly acute trauma. That's a fear of death, loss of loved ones, destruction of homes. We can also talk about persistent traumatic stress related to displacement, unstable housing, loss of income, long waits for reconstruction, family separation. There is also moral and existential trauma, which stands for the erosion of identity connected to the land, fishing grounds, and ancestral places. So for many societies, that sort of trauma is really one of the hardest to overcome. And we have, last but not least, those are very general areas that I would like to highlight, is intergenerational trauma. So we have this disrupted attachment, interrupted schooling, and altered neurodevelopment in children. So we have to remember about that it's also affecting neurodevelopment in children, which are the most vulnerable part of every society and every population. However, there's also another issue connected with climate change. So we have rising sea levels, we have salinization of land, and literal disappearance of islands and coastlines. So we have disappearing islands and coastlines which are going back and back into the land. So people do not have places to live. And entire communities are watching not only their homes, but geography and history slowly to submerge, where this is a form of loss that is physical, cultural, and I would say profoundly psychological. Of course, trauma cannot heal in isolation. So when we look at the communities, they are the first responders. In many climate affected regions, specialists, mental health specialists, mental health services are extremely limited. So we have to be aware that first psychological aid or NAID is very often limited to 0. Or we have one mental health professional per 100,000 inhabitants, or even more. So that's one of the biggest issues we do face regarding delivering mental health aid. And the majority of trauma support is being delivered by families, neighbors, teachers, primary care workers. So that's the group which has to be very well educated. So we have here inclusion of mental health into primary healthcare. So that's one of the key issues we have to face. Of course, faith leaders and community organizers, those are key people in every single community globally. We can say that they are the backbone of trauma recovery. So we can follow up this topic by saying that we can define three pillars of what it should look like, of community-based and like trauma-informed help. So I would say the first pillar would be early stabilization and psychological first aid. Psychological first aid is a guidance provided by the WHO in many languages. So it is absolutely free to use and easy to learn. And its orientation is to be delivered in first hours and days. And just to remember, this is not a psychotherapy, definitely.
Okay.
That's part of the crisis intervention. The second pillar is to provide safe spaces for processing and belonging and restoration. And the third pillar is embedding trauma care in primary care and local government and local governance. And what is probably the most important of all is that we have to have rights-based oriented care. We have to engage young people into the whole system because they would become later on leaders. So when we start educating young people within, like giving them tools such as PFA, so psychological first aid, that would be great. Of course, like to the very end, as we are coming, I have to admit that one of the most wonderful tools that we can incorporate is WHO quality rights and having in mind all the time CRPD principles and ensuring rights-based and non-coercive care.
Thank you so much. Yes, thank you so much, to Bill, for that. A major point that I took from there is the intergenerational, more like intergenerational capacity building, which we know is a great topic now, especially in global health. And now we're going to have our third speaker for today. His name is Dion Raz. And his name is Dion Raz, a youth mental health advocate from the Netherlands through the Global Mental Action Network. He has pushed for greater investment in community-driven and youth mental health initiative. Today, Dion will share insights on youth-centric mental health policy, drawing lessons from both regional and global practice. Thank you, Dion. You have the floor for the next 5 minutes.
Thank you so much, and it's absolutely lovely to be here. I think before we delve into the actual lessons from regional and global practice, I think it's probably good to just kind of quickly course through some context, much of which, thank you so much, Dr. Jakub, but you've already talked a lot about the effects of climate change on mental health, so thank you so much. But I think it might also be good to kind of zoom in on the effects of mental health, of climate change on young people specifically, and interventions that might be useful in addressing those effects. So we kind of already know that vulnerable populations like young people are those that are often found to experience the greatest impact on their mental health as a result of climate change. This was demonstrated in research. And we also know that, just to kind of hone in more on youth as a demographic, we also know that intuitively and based on, again, a wealth of research, that your youth is a very critical period when it comes to the development of mental health conditions. So we know, for instance, that 75% of mental health disorders develop before the age of 24. We know that these have significant effects down the line with regards to physical health, educational attainment, financial means. We know that treatment can help a lot with mitigating these potential negative effects down the line. Now, we also know that, I guess, on the side of care seeking and care access, we know that one, there's a serious discrepancy between the number of young people suffering from mental health conditions and the number that seek care. And two, we know that young people experience quite a lot of barriers to seeking care. So that would be things like stigma, like not being able to afford care, or unsupported parents or caretakers, to kind of name a few. And all of these factors together, all of this context together, the context that Jakob already elaborated on in terms of the effects of climate change on mental health and the kind of inherent qualities of young people as a demographic, really make this demographic very hard to overlook. It's one that we absolutely cannot afford to overlook. So having painted that context, let's kind of move on to some of the promising initiatives and lessons that we've learned from those. So as Jakob, you already mentioned as well, communities are often the first responders in climate crises. And I think I would expand upon that almost by saying that communities are the first responders in many more broad senses, in the sense that they're the first to see what's going on, to perhaps notice, not in every case, of course, but to notice, for example, that someone is withdrawing more. They might become worried about these things. They might be affected, like you might have a child that might be affected by their parents suffering from mental health issues. And so in a very broad, intuitive sense, definitely not a professional sense, they're responding the first, or the most immediate effect or most proximate effect of, I guess, the effect of climate change on mental health. And so, because community is so essential and it's so proximate, I think it might be very valuable to look at community-based care as a means of mitigating the effect of climate change on mental health. And because it's already quite a valuable asset, it's already proven itself through research, through practice, in reaching and providing care to marginalized and vulnerable populations. It has shown that it can reach youth that traditional mental health care systems cannot. It's been very successful in addressing the barriers that I mentioned before, the barriers to seeking care specifically. And there's quite a lot of interesting examples that I'll no doubt mention a bit later on in this webinar as well. But just to kind of move on from, I guess, specific, well, I suppose I'll name the specific examples later, but just to kind of move on from that, the countries that experience like the most intense climate change effects are quite diverse as well in terms of how their care is organized, the resources they have at their disposal for mental health care, and in terms of cultural attitudes and beliefs surrounding mental health. And so then it's really important to note that community-based care is kind of like an umbrella term that describes quite a few different methodologies, some being more centralized and more integrated with traditional systems of care, and others being more focused on equipping members of the community to provide or direct to care. So community mental health care is quite important. I would add on to that other solutions like digital mental health initiatives are quite important as well. And finally, I would add that school-based interventions or online interventions that also increase mental health literacy, aside from providing a service, are very important as well towards addressing the effects of climate change on mental health. So thank you so much.
Thank you so much, Deon. And for everyone that's listening, there is a single word that at least the three speakers we've had so far and what's common that our community-based care down to the roots they are affected, and so interventions down to the community actually means a whole lot. The impact of climate change down to the community has a great effect, and so far that's what I've been able to paint down, and I'm sure the panel session is going to be a great dialogue. Thank you so much, Dion, for your for that. And now we're going to have our fourth speaker for today. Before we move into the panel session, kindly also make use of the question and answer box in order to drop your questions. And so we have Dr. Ashita Umed. My apologies for the pronunciation. She's representing the Health Working Group of Yongo. That's the official youth constituency of the UNFCCC. She has contributed to evidence-informed advocacy, global climate negotiations, and youth mechanism focused on embedding health, especially mental health, into climate policy process. Dr. Umesh will speak on the inclusion of mental health considerations in global climate change initiatives. Dr. Umesh, we welcome you, and please, you can go ahead for the next 5 minutes. Oh, okay. Dr. Umesh, are you here, please? You're muted. We can't hear you. Okay.
Hi,
Okay.
am I audible? Okay, but can you repeat the question? Because I don't think I heard it at all.
Okay, yes. So we just want you
I'm
to
still not able to hear you for some reason. I think there's like a network issue from my side. Could you drop it in the chat box for me, please?
okay. Sorry, I'm typing. Okay, so you have it in
No,
the chat
unfortunately.
box.
Oh, you want me to share my experience? All right. So hi everybody. Thank you so much for having me at this panel today. Apologies for my network and any background noise. I'm currently speaking to you live from COP30 in Brazil. And I love how this conversation has been looking at mental health and mental well-being from a very holistic perspective. So from on ground at COP, we're seeing right now mental health and psychosocial well-being being integrated into negotiations, and it's across multiple different negotiating items and agenda. So whether we're talking about adapting to our changing climate, or whether we're talking about the nationally determined contributions, we're talking about mental health in a way that we need to be protecting our communities, especially those that are most affected. I'm also someone who lives in India and is a frontline healthcare worker. And I've seen quite often that when we're talking about mental health, we tend to exclude conversations on food security, on water security, and even on housing security, which is so very important when talking about climate change because it inherently affects all of these items. And especially for global majority countries that are living hand to mouth every single day. Just give me 1 second. So sorry, I'm right back. When we're talking about the global majority that's struggling to adapt every single day, who's forced to work in inhumane conditions, who's forced to actually work in outdoor settings under extreme heat, because if they do not work that day, they don't have food that day. But we also forget to talk about the violence that inherently happens when you're forced to actually get humanitarian aid. And there were a lot of reports about this, people exchanging food and water resources for sexual favors. And I know this is quite a controversial thing to talk about, but also about conflict affected regions because militarization and climate change go hand in hand. Globally, last year, the spending for militarization was 2.7 trillion USD, but the climate finance that's needed for countries to adapt to the changing climate is 1.3 trillion, and yet we weren't able to close that funding gap. So when we talk about climate change and mental health, and we talk about diplomacy, it is very important for us to also talk about peace and security, especially in the countries that are most affected by climate change. from countries in Sudan to Gaza to Palestine to Congo to even when we're talking about Kashmir and occupied lands, because when we talk about anything that's related to climate and mental health, we do need to talk about how these are still rooted in colonial values, in extractive values. But we also do need to recognize, and I love how this conversation has brought that up multiple times, the resilience that communities inherently have, the way that they respond to this climate crisis, but also the mental health crises. Because it's no longer an invisible emergency, I would say it's quite visible. When we see climate affected disasters, we have mental health psychosocial support systems that come in. But we're still seeing that people with lived mental health experience from before, such as people living with schizophrenia, people living with depression, anxiety, bipolar, are not able to access medication that they've been using for years together because that's not actually integrated into our humanitarian assistance. It's something that comes in as an afterthought. But we also see that communities are the first to respond. They provide comfort, they provide support. And how do you actually empower local communities? You actually empower them by providing them with the resources to be able to cope, but also by providing them with access to healthcare spaces and to humanitarian assistance, which has been continuously blocked when we talk about what we've seen how global conflicts arise. So, all in all, I'll keep this very short. I would say that talking about diplomacy, climate change, or mental health is a conversation that's very interlinked. And we need to go back to frontline healthcare workers, such as myself, that are dealing with this every single day because we're not responding to these crises anymore. We're just adapting and we're hoping that it doesn't get worse, knowing every single day that this response is just temporary and we need to find more permanent solutions. Thank you.
Thank you so much for that. And I loved the aspect where you mentioned and you were able to emphasize that there is a link, climate change, mental health, and diplomacy, and we have to work hand in hand with regards to that in order to make the required change that we want. Thank you so much to all our speakers, and I'm still your moderator, Ebun Ayimode, and right now we'll be going into the panel discussion, and before we have our question and answers, and so first I'd want to jump in and speak or ask Mr. Dion Raz, from your work across mental health system, which regional innovations offer promising foundations for strengthening climate responsive mental health services,
Thank you
especially
so
for young
much.
people? Yes.
Yeah, no, absolutely. And I see this as my opportunity to come back to what I was saying before about the examples of these very interesting innovations. So just to get right into it, generally speaking, I think the innovations that would be very impactful are the ones that reduce strain on the existing traditional care structures and reach vulnerable populations, like young people, for instance. So examples of that, one of them, one very promising one, at least in my opinion, is a community-based mental health care service called At Ease, which provides walk-in centers where young people receive support from trained peer supporters. They are supervised by professional clinicians, and ideally, right, with these kinds of peer support services, ideally we integrate them into primary care through very clear and efficient referral pathways, or even through sharing the same building. Now, that's not always possible in different kinds of contexts, but that is also definitely something to look forward to, or to build towards, rather. Another very valuable thing would be, again, digital services. So some examples would be like chat and phone-based services like the German Krisenchat. You have the Dutch 113 suicide hotline, which is has been shown to be very successful in reaching young people that would not have otherwise sought out care. There are also some digital services that provide mental health literacy trainings and information surrounding mental health. So one example of that would be Spun Out in Ireland. We also see the recently launched In Je Bol in the Netherlands, which is a collaboration between many of the most important and I suppose well-off community mental health services and mental health organizations focused on youth specifically in the Netherlands. Now, beyond that, we see that psychoeducation being integrated into high school curricula was very impactful. And a final example is something called community-initiated care, where young people are taught how to recognize signs of mental health distress and how to initiate conversations surrounding this topic and how to then refer them to resources and care services that the other young person might know of. So all of these, I think, are absolutely stellar initiatives and solutions that I think will be the future to come. Yeah, thank you so much.
Thank you so much. Let me quickly jump to Matthew, and I want to ask, with respect to policy and governance, where do current climate and food security policies show the greatest disconnect between design and the lived mental health impact experienced by food insecure communities?
Yeah. Thank you very much for the question. Well, I think it's quite interesting because at the same time, I believe that the greatest disconnect is often at the local level, but the local level is also where the intersectionality of food systems and mental health is more clear. So we have let's say a two-level disconnect, and in sense, I have a great example actually from a project we have been working on here in Geneva, where looking at people accessing food aid. We have a city which is extremely wealthy, and yet not only has still 10% of the people in town basically accessing food aid, but there is fundamentally no consideration of the mental health of the people while they access this food aid. And so we have just a focus on the producer side, on production, and on the food aid recipients on having enough calories that can go just from like the absolute number of calories to the quality of the diet, but then there is no focus on the mental health of the people who are accessing it, and how the experience of accessing food aid is and how does it fit in their broader mental health, and in particular for a place like Geneva is particularly important, given that the right to food and the right to health are both in their constitution, at the regional level, because Switzerland is a federation. And so I think that the greatest disconnect is at the local level, but there is a lot of work to support the local level that must be both top down, as in the, let's say, international and national level needs to further push on this, and on the local. And I think that there is where youth has an extremely important role to play, first for the ability to actually see what's going on at the local level, which is something that youth, in my sense, is particularly keen to do, also because it's less accepting of how the situation is, and the other, it's in the horizontal networks and partnerships. So many of the networks that are here today have a super important role of having people who working in different places with different knowledge, but still talking, and avoid the creation of the silos that then leave issues like mental health behind.
Thank you so much, Matthew. I'm going to take you up on that. The point you made about the regional, the vertical and the horizontal relationship. And so talking about cross-regional learning, Dr. Yakub, I'm coming to you from the spectrum of community-based mental health approaches implemented across regions. Which models show the great potential to be scaled or diplomatically adapted for climate-affected settings, especially in ways that strengthen local leadership, cross-sector coordination, and long-term resilience?
Thank you for that question. It's very important, but I think that what we very often forget about talking about models is that models should be rooted in culture, in locally and culturally adapted settings. Those models should be based on absolutely fundamental. Well, that's absolutely fundamental for me. That all models should be based on cultural values, because to a certain extent we can scale up the model. To certain extent we can adapt a model from, let's say, EU to anywhere in the world. However, if we want to respect cultural values, we won't reach anything. So that's a key issue. And another issue is regarding those models, that as long as we are able to provide a model that would respond to needs of local communities plus needs of system users, we have to implement them. What does it mean? That means that we have to engage into co-production of the models, service users, local communities, aid workers who would be fully aware of local context, because rights-based, it's not only respecting human rights, dignity, but also respecting local cultures. Without that, we won't be able to deliver proper help. And what is probably one of the most interesting things in global mental health aid delivery is that we have to be aware that sometimes when we are stepping into some sort of environment with aid provided by external people, we have to be aware that there are communities where we would need to have cultural interpreters, cultural translators, in order to translate idioms or a description of what's happening to a person to a healthcare provider, to first aid responder, to mental health first aid responder. Like if we would take the whole variety of migrants who, for example, are coming to, there's a great example of people coming to Canada, where Canadian McGill University established a program that allows people to learn how to talk to minorities, to communities that come from different parts of the world. Because we have to be aware that, like, current influx of people is totally new for everyone. We have never experienced such an influx. So that is to say, like, I guess that bilateral cooperation within neighboring countries might be a key to establish a working solution and models that might be scaled somehow. But we have to remember one thing, that very often within one country we have such huge number of tiny communities with their own medical, let's say, medical language, with their own explanation of symptoms, that, you know, without respecting that right to preserve cultural values, we won't be able to help. I guess that that might be the answer to all those questions.
Thank you so much,
you.
Dr. Yakub. I love the idea whereby we're dealing, most of our responses is back to the community, and community representation is key. And also that interconnectedness, trying to state that we need everybody's hands on deck. And I'm happy that we're having this webinar to bring that point out. And I'm sure that's one of the key things taken back after this webinar, whereby when we go back to our desk and we want to implement such models, these are the things we have to, have in mind. That cultural context is very, very important. Thank you so much. And with regards to that, I'm going to come to Aisha. Aisha, given your experience, leading youth networks across the Commonwealth and South Asia, I just want you to share briefly, how do you see youth shaping the integration of mental health within climate and health policy frameworks globally?
Yeah, hi everyone. So just a bit more background about myself. I'm a medical student based in Pakistan, and Pakistan is a highly climate vulnerable country. And Pakistan and the countries around it, there's this belt of other climate vulnerable countries who are dealing with the climate crisis very head on. And so I want to bring a couple of insights that I've sort of gained in my entire journey when it comes to advocacy in the climate health space. And that is that, mobilizing the resources around you as a youth advocate, and having this bottoms up approach when it comes to targeting advocacy is, I think, of the most benefit to approaching climate health advocacy in the South Asia region specifically. For us specifically, from Pakistan, when you read these climate change policies, you'll see the mention of mental health. You'll see the mention of marginalized communities in writing. However, then the gap lies in implementation, when it comes to providing these services that have been mentioned within policy. And so then what ends up happening is that, you have these wonderful, really comprehensive documents that are, readily available on government websites. And you can read them, you can peruse them, and you can think like, oh, this is a wonderful piece. But what's really missing at the grassroots level is its implementation. So one thing I really like to categorize, two major groups when it comes to the discussion of climate and health and mental health. One is your geographic periphery. So it's like the regions which are difficult to provide services for. In Pakistan's case, it's regions such as within Balochistan or KPK. Those are, those mountainous regions where it gets really difficult to then provide access to, psychological first aid, to psychiatrists, to, a mental health support network. But then there's also your systemic periphery. So I was involved in a lot of research projects when it came to the effect of the climate health crisis on women going through menopause within rural Pakistan. And so that's a sector that's not really talked about when it comes to climate and health. And so it's really important as youth working in this space and really trying to garner all your resources around you is to, really, really capitalize on that bottoms up approach, go to climate spaces, discuss, how important the health aspect of this is, collaborate with other organizations and really do as much as you can, because I've noticed within Pakistan, at least, what ends up happening is that we have these wonderful discussions on global forums, then it kind of trickles down on the local level. And so I think we're at a time where it's really important to, to keep in mind all the discussions which are happening in our global health governance spaces, but then also, try as much as you can to mobilize your peers and your resources around you and really address both the geographic periphery within your region and also the systemic periphery, which can be excluded sometimes through very general policies, and then, make your way in this climate health space. So that's just a little bit of my insight.
Thank you so much, Aisha, for that. And to you, Dr. Umez, I hope I pronounced your name right, my apologies. Final remark from COP30, what do you think is the way ahead and what should we focus on?
COP30 has been told to be the COP for implementation. So I think the final way forward is implementation, right? Like we want to see this coming down to the communities. We want to see finance flowing into the communities. We want to see the loss and damage fund actually do the work that it was made to do, right? So it's a really simple answer when we talk about it that way. But we also need to see countries actively acknowledge that the current Paris Agreement, though it's helping, it's not really there. Like we have crossed a lot of global climate tipping points, and we continue to do that because countries are not having enough ambitious action. So I do think that that's some place where COP needs to come in, and we need to have a lot more multilateralism because while Aisha mentioned one of her countries is her country comes under the least developed countries. There are SIDS currently that are going underground and underwater because of the rising sea levels. There are other countries that are also losing a lot of farmland because of militarization. There are other countries that are losing human lives because people just do not care about the cost in those countries. And it then comes down to a matter of justice on whose life is being prioritized. And as doctors or frontline workers or anybody in the health field, I think we are owed to know that all human life is extremely precious. So how do we protect it from all different stances? I do love that, Matteo, you brought in the angle of food security and how this really plays in because food and nutrition is something that's being debated upon in the Sharm el Sheikh Joint Working Group agenda, where they're pushing for more agroecology, but they're also pushing towards protecting natural biodiversity and integrating that into systems itself. And I think that's so important because we do want communities to be empowered. We do want youth to feel like, hey, farming is still a good profession, considering that farmers are the people that feed us. And the UNFCCC does have a farmers constituency, so it's always really nice to hear them speak about the work that they're doing and what they need. But I also think that COP needs to be a lot more inclusive as a process. I know a lot of people who haven't been able to be here and such privilege to be here right now talking to you because of visa issues, funding issues, and other restrictions. So I do think as a process, if we really want to move away from what's being negotiated to coming down, COP needs to do a lot more in terms of implementation, but also opening up these spaces because until policies are informed by those who are affected the most, those who are the most impacted, those who are the most marginalized, policies will not be inclusive. And until these policies are not rooted in jargon, and as Dr. Bill was saying, that we do need to preserve cultural land and indigenous people, if you've heard the recent news from COP, actually stormed the blue zone because they felt like their voices are not being included. And for context, COP actually invited over 2,500 indigenous people, and that's the largest representation we've ever had. And there are a lot of indigenous people in the green zone. But the fact that they're not at the blue zone, only like 400 people were given passes to be at the blue zone, also speaks to the enormity of the problem because they are the custodians of 80% of biodiversity hotspots and they've learned to coexist peacefully. And yet we're still trying to find out Eurocentric, westernized values and how do we move forward when these have not actually caused, when these are the reason that we have the climate crisis on our hands right now. So I think in short, it's just three things. One, policies need to be made for the most impacted, the most affected, and the most marginalized. And two, finance needs to flow for locally adapted solutions that empower communities. And three, COPs need to be a lot more inclusive, and we do need more funding and less visa restrictions, especially for global majority countries that are being affected the most. Thank you.
Thank you so much. We have few minutes about to wrap up, but before we go into the question and answer, just in a minute, Dion, what's the way forward that you have for us? Just in a minute.
The way forward in terms of?
Moving forward from this dialogue, what would you want us to go back and with regards to community to work on? What would you say? What would you advise?
I think a lot of very interesting things have been said, a lot of very useful, like the innovations that I mentioned, of course, the things mentioned on first responders by Jakub Biel. I think a lot of these things are very interesting, and just as I believe Aisha also mentioned, I feel like we've talked so much about this. We kind of need to move on towards implementation. If we could get one collaboration going from this webinar, that would be amazing. Because it's kind of the same thing. I imagine every one of us has probably already seen it before and is probably tired already of it. About tired with talking about it without moving on to implementation. So if we could move on to implementation, that would be amazing.
Great implementation, and Dr. Yakub has given us a model, quite frank, on how to go about that. And thank you very much to all our speakers. Please know that their LinkedIn link is in the chat box, and so please, you can still follow up on them. And like Dion said, collaboration is very key. We have a question, and we'll just address that. 2 questions, actually. We would address that, and we would have to call it a day. And so the first question that I have here is to Dr. Bill. From your perspective as co-chair of the Universal Health Coverage Working Group, what are the 2 or 3 concrete governance or accountability mechanism should country prioritize to ensure that there's rapid scale-up of mental health services, especially in low-resource settings?
Thank you for that question. As far as I can see, that question comes from the chat. And, I can see that, like, also the second part of the question, if I may, not reproducing coercive or rights violating practices, I would add. From my experience is that whatever mechanism we are trying to explain, we are trying to implement, we are trying to do, there's only one, well, that's a global issue. It's one global issue we have to overcome, and that's stigma. Without understanding and explaining to policymakers, but also at grassroots level to local leaders, to religious leaders, what mental health in fact is, we will never succeed. So from my perspective, like, that's the first step to go forward. That's the first step to overcome. Later on, we can implement everything, literally everything. However, as long as we wouldn't have the understanding of what is going on with the whole spectrum of diseases, how people with lived experience are trying to live, what they're trying to tell us, as long as we won't incorporate them into co-production of any solution, we won't be succeed. We can talk about different mechanisms, different ideas, but I think that, like, from my perspective, we shall start from the beginning. It seems very simple, but I guess that's the most simple solution we have to implement at the very first place. Thank you.
Thank you. Thank you so much for that. Thank you so much for that insight. And well, we've come to the end of today's webinar. A big thank you to all our speakers. A big thank you to all our participants. Kindly know that, like I said, their LinkedIn is in the chat box. Please network, connect with them. You can ask them more questions. I'm sure they'll be willing to answer. Thank you so much, and have a lovely day, everybody. Also, please, you can follow HDYN. The links is up in the chat. Kindly join the network. And also, we also have AMR webinar coming up on the 24th of November. Please let's ensure that we come and also learn. It's actually going to be a great webinar as well. Thank you and have a productive day. Bye.
Thank you.
Thank you. Bye.
Thank you.